So I'm just going to use a disinfection. Great. Okay, so hi. My name is Dr. Kewa, and today I'll be doing a full body examination on you. Is that all right with you?
Yes, of course.
Okay, perfect. So it will involve me touching you, also asking you some personal questions as well. So let's just start. I will ask you to state your full name, please.
Yes, my name is Anastasia Podshikayev.
Okay, so like this, perfect. Can you tell me what is your age?
I'm 22 years old.
So 23 years old. That's perfect. And how much do you, or what is your height?
I'm 168 centimeters.
68 centimeters. And your weight, if you don't mind me asking?
56 kilograms.
56 kilograms. That's great. Do you exercise?
I do from time to time.
Okay. What kind of exercise do you usually do?
I usually do stretching exercise, some yoga.
Yeah. Yoga, that's great. Do you have any medical history, problems, any injuries, any kind of operations?
No, nothing.
Okay. And since we are doing a regular checkup, do you have any current problem that is bothering you?
Absolutely no, nothing. Everything's fine.
Do you take any kind of medication?
No.
That's great. Do you have any allergies?
I do have allergies. I'm allergic to dust
Dust.
and to some animals, mostly cats and dogs.
Okay, cats and dogs. Do you have any troubles breathing, like asthma or anything like that?
Sometimes I do have, and I also get some rashes, especially at this part of body.
Okay. Yeah. So I think that if I will have any other question, I will just ask you during the examination.
Yeah.
So I'm just going to look at you first. I'm just going to generally assess your skin and the color of your skin. I will look if there is like any kind of rash or anything like that. Okay. So I'm just going to lift your... That's great. I do not see any kind of rash. Just going to move your hair to the back. We'll look at your neck as well. That's great. Now from the other side. Okay, seems good. Just going to use the light because there's a lot of shadow, so I do not really want to miss anything.
Okay.
And there doesn't seem to be any redness. Okay, now I'm just going to be palpating your head. I will be palpating the skin. I will be trying to feel if there is any bump, lump or anything. If there is anything hurtful, please just tell me.
Okay.
I will then look into it. So do you sometimes have troubles with your scalp itching?
No, not really.
Okay. Okay, I'm just going to look into your hair. Can you lean forward for me a little bit? Okay, I'm just going to look if there are any flakes. And it actually seems that there is not much flakes actually, which means that your scalp is nicely hydrated. Do you use any kind of oils?
I do actually many kinds of oils, like argan oil, sometimes coconut oil. I also use, I believe it's called jojoba oil.
Yeah, I know what you mean.
Yeah.
Okay, but this seems fine. I also am looking at the color of your scalp, looking if there are, again, any redness, any bumps. That's great. Yep. And your scalp seems to be absolutely nicely hydrated everywhere. I do not see even any patches of losing hair. You have plenty of hair, obviously, so that's great. I'm just going to write it down. So, did the scalp examination, which is going just fine. No balding, no balding. Great. So now I'm just going to look at the color of your arms and your neck as well. Alright. Are you aware of having any kind of rash or any redness, anything that is bothering you lately?
Currently,
skin-wise? Okay.
Only some time ago when I had allergic reaction, but it didn't happen for
But
a
it happens
really long
only
time.
when you are in the presence of cat or dog and when there is dust.
Yes.
Yeah, that's good. So I'm just going to again the skin and now your arms as well. I'm sorry, my hands are a little bit cold, unlike yours. Nice nails.
Thank you.
Do you, when you're not having your nails done, do you sometimes have them like those white marks?
I do have sometimes.
Okay. It is actually said that it is supposed to be when you do not have enough calcium, but it's not completely true. It's also when you just like bump your like fingernail really hard. It also like happens as a, like if you would just, had a bruise there basically.
I see.
I'm just going to look in between your fingers. That's good. Now here on the inner side. Okay, I'm just going to be palpating your joints and tell me please if you feel anything painful here. So I'm pressing the joints and then the tip of the finger. Okay, that seems good. Great. Just looking if there are any scratches or anything, if there is any redness, any infection. Your hands are nicely warm, which is great. You have a great blood circulation. Okay. Just going to look in between the fingers again. Okay. Do you have any pets at home?
I don't.
Okay. Sometimes when people are allergic to something, they still kind of do have the pets they are allergic to.
Yes, I know.
So I was just wondering.
Yes, I actually know personally someone who believed that it would help him to overcome allergy.
It's actually my whole family basically, so I exactly know what you're talking about. That's why I even asked. Great. I do not see any kind of redness or any rash here that you were talking about previously. That's great. I'm just going to also check. So, I'm just going to check the moles. If there is anything that could be potentially harmful. I'm also going to look at the other hand as well. But it looks really, really like normal. There is one that is bit. Okay, that's normal. Great. Just going to take the light on this one. Okay, and it's actually some kind of infected, slightly a hair. That's good. Nothing to be worried about. You can just pluck it away and it will go away. Okay, so what I'm going to do now, I'm going to check your eyes. I'm going to shine a light into your eyes. We are going to check if there is pupil constriction and dilation. So I'm going to shine a light into your eyes. Okay, great. We are trying direct and now consensual constriction. The consensual basically means that when I shine a light into your, for example, left eye, your right eye will constrict as well. I'm just going to look from the temporal side and I'm going to get really close and I will look at the sclera as well and if there is anything that could be potentially harmful.
I actually made a laser some years ago.
You had a laser surgery?
Yes.
That's good. And when approximately was it?
It was around 2 years ago.
2 years ago. I actually thought about it too. I'm just keep postponing it. Okay, so that's good. Now I'm just going to do some tasks with you. I will ask you to look into the distance, like the handle, if you can see it. Okay, I'm just going to be then moving my fingers and just follow it. Can you see it?
Yes.
Yeah.
Can I look into the distance?
Now look at my finger, and now look into the distance. Yeah. Now look at the finger. That's great. Now just keep focusing on the tip of my finger, and I will get it close and keep looking at it. Keep looking at it. Great. Perfect. Now, if I can ask you to cover one of your eyes, and I will be just moving my finger like this. You will keep your gaze at one point in the distance again, and you will tell me when you see the wiggling fingers, okay? Not when you see my hand, but really when you see the wiggling fingers. I'm going to cover one of my eyes as well, so that we can actually really tell if your eyes are okay.
I see.
You can say no.
No.
Okay.
No.
Mm-hmm.
No.
Okay.
No.
Mm-hmm.
No.
Great.
No.
Great.
No.
Mm-hmm.
No.
Great. One more for me.
No.
Great. Now just switch your hands, please.
Yes.
And let's just do it right there.
No. 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 No.
Okay.
No. 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 No.
Okay, it kind of seems to me that your right eye has like better peripheral vision than your left eye. That was just my observation because you reacted a bit more quickly on this side than on this side.
Yes.
So
I
just
noticed
for you to know. Okay, I'm just going to write it down. Okay. Great. So now what we are going to do, you will look at me and then I will just move my finger. You will keep your head still. I will be just moving the finger and you will follow it with your eyes, not with your head though. Okay, so trying the extra ocular movements. Okay. Now that we dusted this, I'm going to do it one more time, and you will tell me if you see the finger twice. It's called double vision. So I will ask you, do you have any double vision? And you say no. Or if you see any double vision, it's basically like when you are looking at the cinematography and people are doing the drunk, vision basically.
Yeah.
It's about the same as the double vision, okay? So any double vision?
No.
Great. Okay, no double vision?
No.
Great, that's fine. Okay, so that seems perfect. So it seems that your eyesight is really good. I'm going to write letters. I'm going to write letters on this sheet of paper, and you will read it for me, okay?
Okay. A. D. H. Z.
Perfect. Perfect. So that seems fine. Okay. That seems good. Perfect. So what we are going to do now is that I'm going to palpate your face. Yeah, if you tell me if you feel any pain, I will try the sinuses. Okay. So first I'm just going to start at your forehead. Any pain when I press here?
None at all.
Any pain when I press here?
No.
Okay. Any pain when I press here?
No, no pain at all.
Okay, around your ears, any pain?
No.
Okay, great. I'm just going to be also palpating here. I will be palpating your lymph nodes. So, just going to, okay. Just looking for any swelling. Were you sick lately?
I was actually about 2 weeks ago.
And do you know what kind of sickness it was?
I believe it was just cold.
Cold.
Yeah.
Okay. So you did not have COVID or anything like
No.
that? Okay. Okay. So going to check your pulse as well. So I'm just going to find the... Okay, that seems good. Let me check your pulse on your hands as well. Okay, that's good. Nice and strong in both hands. Great blood circulation, as I already said. It was like very visible, like unlike me. Yeah, I barely can feel my pulse, so that's because I really have even the cold hands, so yeah. Okay, and I'm just going to look at your ears. Okay, just looking again if it's any redness, if it might be infected. I'm going to be pressing right here on the mastoid board. Tell me if you feel any pain.
No, I don't.
Okay, any troubles hearing?
No.
Okay, we are going to test that. I'm going to take my gloves. So you will close your eyes and I will do a sound. The sound is like this. And you will point to the side where you hear the sound. And if you want to, you can say right or left. Depends on which side will you hear it. Or on both, when you hear it on both the sides, okay?
Okay. Right, left, both, right, left, both, or right, left, both, both.
Great. Okay, so I'm just going to take the light, look into your ears. Do you find yourself sometimes having troubles to hear what people say?
Sometimes, usually when I'm in crowdy spaces.
So usually in a restaurant or when there is a construction
Yes.
and stuff. Okay, but otherwise you do not have any problems like when you are in a conversation one-on-one?
No, only in
Okay.
crowdy spaces.
And you should hear a sound in both of your ears. It might be more prominent on one side than the other. So just notice where do you feel it more or where do you hear it more basically. And just tell me, it can be even like same at the both sides.
Okay.
Lowering it a little bit more. Great. So. Can you hear it?
Not really.
Not really. Okay, I will make it one more time. Can you hear it now?
Yes, in the right.
Just in the right?
Yes.
Okay. So let's just try to put it behind your ear. Oh, like this.
Yes.
Okay. Can you hear it?
Yes. Strong.
Okay. And once you don't hear it, tell me. Can you still hear it?
Yes. No, I can't.
Can you hear it now?
Yes.
Okay. Now on the other side. Okay.
I can hear it.
Tell me when you stop hearing it.
No.
Okay. Can you hear it now?
Yes.
Okay. That's great. I'm just going to look into your ear real quickly. I'm just going to pull your ear a little bit up like this because you know the ear canal actually straightens and I have like a better look into the ear because usually the canal is like really, let's say, wavy. So I cannot really see into it that much, but okay. There is some earwax, but not that much. Okay, that's great. I can see the eardrum. It's pretty visible and nice. There is no problem. There is also the light reflection at the end of the tunnel. So I'm just going to pull your ear again. I don't want to pull your hair as well, so I'm just going really carefully. Okay, so let's just look into the ear. Okay, there seems to be a little bit more wax than in the previous one. I still am able to see the drum though, so yeah, that looks good. There should not be no problem. I will not recommend you to use the Q-tips because you should not use them. However, if you just go to a clinic for ear cleaning, they can actually kind of get rid of the wax in the ear because otherwise you will probably have a buildup, like not like immediately but in some time, you know, because like the body produces the wax still, there actually needs to be a little bit of the wax because it like collects, you know, the dust and the particles that we don't really want to get into our ear. So there is really a good amount, but I would advise you to go there so that there is not build up in the future.
I was actually wondering lately, how can you, well, not get rid totally of the wax, but how can you clean it maybe at home?
Yeah.
And I heard that, how did you call it? Like
Q-tip.
Q-tip are not the best method to do so. So I guess, yes, just going to the doctor would be the best option.
Yeah, it is actually said that it like pushes the earwax like more into the ear canal and to the eardrum, which is like where you don't really want it because you then cannot really hear.
Yeah.
And it's actually really hard to then extract it from the ear because it's really close to the eardrum, which can be easily heard. So it's definitely just better to like go to a professional. There are also like some liquids that you will just put into your ear and it will kind of like soften it as well or like flush it away.
Okay.
Yeah. So yeah, that's great. So I would just write the findings down from your ears. Now, if you want to, you can close your eyes, and I will actually look with my light the skin on your face, so that the light doesn't hurt your eyes. So I'm just going to be working. I'm looking whether the skin is well hydrated. How much water do you drink usually?
I try to drink at least 2 liters of water every day. Sometimes it's even more, around 3 liters, I would say.
Okay, I can see some blackheads, which is absolutely normal. They are not somehow like dilated, like they are not huge, basically to say. Your nose actually do not have as much blackheads as is usual. You do have some little pimples though. That's very normal. It's usually from the hormonal cycle.
Yes. Lately I also had a pretty stressful time, so I guess it's also how the
from
skin,
stress. Yes. That's actually also very normal. And do you usually have it from stress, or is it like a really hormonal, like just before your period, basically?
Yes, I believe it's both. Basically, every single time before my period, I get skin changes.
Yeah.
And especially now, I had a pretty busy month before the wedding and quite a lot of, emotions and so on. So it also had an effect on my skin.
Yeah,
I could clearly see it changing,
Okay, and do you sometimes like struggle with oiliness or dryness? Do you use any kind of cream or oil that you apply?
I do use some creams, usually moisturizing creams, and when it comes to oil, so I use like jojoba or jojoba oil. Yeah.
And is it like, do you use it like every day?
I try to. Well, not the oils, but the moisturizing cream.
The moisturizing cream,
yeah.
Okay. Okay, do you tend to have the acne breakouts even somewhere else than just like on your face or neck?
So, no, only the neck area and the face.
Okay, because sometimes it's also on the back or on your hands as well, or even at the chest sometimes. So I was just asking to make sure. Okay, that's great. But your skin seems nicely hydrated. It's not dry at all. I can actually tell that you are drinking a lot of water and using the moisturizer every day. It really does a huge difference in how the skin looks after. I'm just going to great. Put your hair back on its place. So what I'm going to do now, I will ask you to turn around and just like take off the sweater. I will swiftly look at your back.
Okay.
Okay. So I'm going to be listening to your breathing. So I will put your hair aside first. Like this, and I will just listen to your lungs. So if you can breathe for me a little more deeply than is usual.
Yeah.
But you do not have to like breathe up if you were running a race, you know.
Okay.
So that you do feel it's forced, you know, somehow. Okay. So here we go. Okay, that's great. That's good. So your breathing is absolutely normal. I did not hear any wheezing or anything. So I'm now just going to look at the skin on your back and on your shoulders as well. So now I'm just going to palpate, and you tell me if you feel anything that is uncomfortable. So I'm just going to be okay. Okay, so now I'm just going to press a bit more harder on each vertebra. Again, if you feel any pain, just tell me. Do you happen to have any back pain during the day or just normally?
No, not really.
Okay. I'm just looking if there is any tension in your muscles. That's why I'm palpating. Okay, so now I'm just going to percuss as well. Just going to listen what it sounds like. Any pain when I'm doing this? Okay, so that seems to be good. So now I'm just going to test if you can feel sharpness and dullness of objects. So basically, the sharp feels like this. Can you feel that it's sharp?
Yeah.
Sometimes it's hard to distinguish it on some parts of your body because there is like naturally more fat on some tissue. So sometimes it might be harder, so I have to press quite hard. Okay. Anyway, this is the soft part, or dull. You can say soft or dull, whatever you prefer. So I'm just going to use both of these, and you will tell me whether you feel that it's dull or sharp.
Alright.
Let's just move your head aside again and
Sharp.
yes, it was sharp.
Dull.
Yep.
Sharp. Dull. Sharp. Dull.
Great.
Sharp. Dull. 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 Sharp. Sharp.
Correct.
Sharp.
Perfect.
It felt dull.
Yeah.
Dull. Sharp.
Yes.
Dull.
Yes. On your shoulder.
Dull.
Now on your
Sharp.
perfect. That's great. I'm just going to try it on your neck as well. Did you have any head injury during your life?
No, never.
Okay.
Dull.
Yes.
Sharp.
Yes, it was sharp. Great. Perfect. So now I will just ask you to turn around for me, and we will do the sharp and dull also at the front.
Alright. Do you mind if I just put...
No, put it on. So I'm just going to try it on your face as well. I'm just going to move your hair a bit to the side. Great.
Dull.
Yes.
Sharp.
Yes.
Dull. 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 Sharp. Sharp. Dull. Again. Sharp.
Yeah.
Dull. Sharp. Dull.
And I'm just going to take one of your hands. Keep your eyes closed. And we'll do it even here.
Dull. Dull.
Just going to turn your palm.
This seems dull. This is sharp.
Yeah.
Dull.
Yes.
Sharp.
other hand, you can this to me and like this. You can close your eyes again. No cheating necessary. Down. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. 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 Perfect. Okay. Great. Now you will close your eyes again and you will just try right and left. When I touch you on your right side, you say right. When I touch you on your left side, you say left. Okay. Left. Right. Both. Again. Both. Left. Right. Left. Left. Right. Right. Left. Right. Left. Left. Right. Left. Right. Left. Right. Great, it's perfect. So you can open your eyes now. Okay. So I'm just going to write everything down again. Great. Okay. So we are done now. Alright. Thank you very much.
Thank you so much.
So you are absolutely healthy. There is no problem with you, except you have allergies, of course. However, today I had no findings. So, okay, great. Thank you.
Thank you
Bye.
so much. Bye.